If you followed my work, you know that I consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. If you're already taking omega-3s, you should know that I've discovered a product so special that it's become my go-to brand. Dr. Jeffrey Bland, one of the luminaries in the world of complementary health, takes omega-3s to a new level. Omega-3 Rejuvenate from Big Bold Health is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. Unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen, and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman20 for 20% off site-wide. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. It's our weekly Q&A with Leyla, wherein we answer your questions. And questions usually come to questions@drhoffman.net, but I snagged this question off of Facebook Messenger from a gal who I went to high school with. And now she's a grandma, and she lives in Mexico, interestingly. I guess
Wow.
it's a less expensive place for Americans to retire to. You get your Social Security and your dollar goes further if you live in Mexico. Anyway, so here's what she said. She says, okay, so she sent me this email because we were talking about vitamin K2.
Yes.
Yep. Mm-hmm. She says, so the question after watching this video is, what is the correct dosage and ratio of D3 and K2? And there's a video here that she posts from Dr. William Li, L-I, and Chinese. It says, over 60, stop taking K2 plus D3 combo pills before they destroy your kidneys. And
What?
the subtitle is, many seniors trust K2 plus D3 combo pills to support strong bones and heart health. What's less discussed, et cetera, is about, that it's going to destroy your kidneys. So, so I looked this guy up, and I never heard of him, but he has a presence on YouTube, and he has a lot of followers. And his background is interesting. According to his bio, he's a reputable Harvard-trained MD who's done some important research on something called angiogenesis, which we actually have a question on today. Talk a little bit about angiogenesis.
Okay. Yeah.
So it's hard to understand why he's so poorly informed about vitamins D and K, because in fact, you can mess up your kidneys by taking too much vitamin D. You can.
Absolutely. Yes, you can.
But that is one of the side effects of taking enormously high doses of vitamin D, like more than 10,000 international units per day. And I actually saw, and I've discussed this, I actually saw a kid.
For a long period of time. Yeah.
Yeah, I actually saw a kid who, after, I think it was what he explained to me is that during COVID, he heard Anthony Fauci say that vitamin D might be helpful for preventing COVID or reducing the severity of COVID. So he ended up taking vitamin D daily, 50,000 international units every day.
Yeah,
and
I remember
he did that for about 3 months until his mom discovered he was taking these astronomical doses. And the mom called me up and said, you have to see my son immediately because he's killing himself. And I tested this guy 6 ways to Sunday, and there was no kidney damage. And he did have astronomically high levels of vitamin D, but there was no harm, no foul. Now, he's a younger kid, was in his 20s, so he probably had more kidney reserve and, maybe was less vulnerable to the adverse effects. But this to me was a demonstration that there's a pretty high margin of safety, because I would say, I mean, Leyla, you don't tell people usually to take more than 10,000 IUs of vitamin D. And if you do, it's for a short time. And then you want to measure, maybe they come in and they have multiple sclerosis or something, and you know that there's a benefit to vitamin D. So you take a lot of it, and we'll check you every 6 weeks, and we'll follow it to make sure you're not going into the toxic range, right?
Vitamin D dosing. Generally, if levels are very, very low, I might have them take a high dose for a period of time and have them rechecked and then lower the dose once again. For example, whether it's 50,000 IU once a week or it's 10,000 a day for a period of time. But Dr. Hoffman, if this Dr. Lee is saying, don't take a D with a K, does that mean that I can't enjoy a steak for lunch in warm weather in direct sunlight? Because I'm getting K from the steak and D. What are we talking about?
Yeah. It's like,
what are we talking about?
I mean, then lifeguards would get, kidney problems because they get about 10,000, sitting in the sun every day, they get 10,000, the equivalent of 10,000 IUs of vitamin D.
At least, sure.
Yeah. So I don't know.
So I'm not sure what this is about.
I don't know. I just wonder.
I've heard other doctors say, Dr. Hoffman, I heard another practitioner, I wish I remembered his name. He was at IHS, the Integrative Healthcare Symposium, a couple of years ago. He said it like this, and I almost sat on the edge of my seat. He said, taking vitamin D without vitamin K is malpractice.
Well, not really.
Not quite. Not at all.
I mean,
actually.
I think, that's hyperbole. I mean, I think there's a benefit to taking these things together because there's synergy between them.
Yes.
Also, I think it's important to take magnesium with vitamin D because magnesium helps to activate some vitamin D pathways. So, if you're really magnesium deficient, you're not going to get the full. Look, my conclusion is this is a little bit of a throwback to when I was in medical school. We used to think that vitamin D was kind of deadly. That if because the IU, I mean, the RDA was 400 IUs per day. And they thought, oh my God, the dosages we're talking about, 2,000, 5,000, 10,000. Doctors back in the 1980s would roll their eyes at that as like, oh my God, you're going to kill your kidneys. You're going to get calcium deposits in your kidneys. And I wonder if this doctor is still under the sway of like a 1980s mentality about vitamin D. He's behind the 8 ball on this. I mean, he's written books about diet and nutrition, but it's almost like he seems like an influencer without knowledge, without a real good knowledge base.
Right.
I mean, he's over his skis on, and also a lot of this is clickbait stuff. Like, so it got my poor, high school alumna. It kind of poisoned the well for her to take vitamin D3 and K2, which would be helpful for her.
Yeah.
As a woman, I think osteoporosis is an issue, and then older age, you have cardiovascular risk. So I think would be a good combo.
Well, if that's the case, and if this doctor is correct, we can't have a steak at lunchtime, sunlight outside in warm weather.
So I looked it up too. In fact, there are vitamin D protects the kidneys.
Mm-hmm.
Yeah. There's actually a study that shows that vitamin D in chronic kidney disease. So even if you have kidney disease, there's a study. Let's see, renoprotective effects of vitamin D. Okay.
Fantastic.
Protective effects of vitamin D.
Yeah.
They say are far beyond its classical role in the maintenance of bone and mineral metabolism. So, it actually is not only not harmful, but maybe protective if people have some form of compromised kidney function,
Absolutely. And vitamin D.
You got to be careful. You got to be careful with vitamin D. Look, if to somebody who's got like kidney failure, you got to be a little more careful. You got to be more careful.
Absolutely.
Yeah.
You got to be more careful about everything.
Everything.
With somebody with kidney failure.
So anyway, so if you went to high school with me, you can, message me on Facebook. then, but for the rest of you, questions at drhoffman.net.
Mm-hmm. Questions at drhoffman.net. All right. Joe, thank you very much for that thoughtful question. Okay. Let's see here. Oh, we've got a question here from Matt. Hi, Dr. Hoffman. Reviewing the allergy protocol, I was wondering
The what protocol?
if you would recommend
Repeat.
allergy protocol.
Allergy protocol.
Allergy protocol.
Mm-hmm. Mm-hmm.
I was wondering
and by the way, that's on.
Yeah.
That's on Full Script.
It's on on Full Script at Dr. Hoffman. Yes.
Store.com.
drhoffmanstore.com. That is drhoffmanstore.com. A little more on that later. So reviewing the allergy protocol, I was wondering if you would recommend Moducare or plant sterols for immune modulation purposes. And downsides, I'm worried they will lower testosterone levels. I can't see why a plant's cholesterol, which are the plant sterols, how would that lower testosterone? Our cholesterol is the substrate where testosterone and other hormones are made.
Well, there actually is this thing where taking a statin will lower your testosterone by about 10%.
That's true.
It will lower your testosterone.
Right.
So anything that might lower or interfere with synthesis of cholesterol,
Yes.
at least in theory, might also interfere with the testosterone pathway. But, I'm not sure that that's that consequential. It might be just, a couple of single digit points, if at all.
Yeah.
So I'm not that worried about that. Question is, should we use Moducare for allergy? Moducare is something that I use for autoimmune disease. I think it is, but it's a little lower down on the totem pole when it comes to allergy. And I had to, frankly, I can't tell people to fill up their shopping cart with $600 worth of supplements to treat allergy. I've got to limit it to the top things. Top 2, 3, or 4 things that are kind of basic things
Makes
for
sense.
allergy. So we might have stinging nettles, and we might have quercetin, which is an allergy, kind of thing like that. So vitamin C, of course.
So really, in the autoimmune realm, that would be Moducare.
Which is a product that, interestingly, is made by the same people who make Kyolic aged garlic extract. It is Wakanaga that makes Moducare.
Yes. Yes. Okay. Matt, thank you for your question. Let's see here. Oh, we've got a question from Bob. A few months ago, after learning about a new creatine supplement from one of your podcasts, Dr. Hoffman, I began taking it. However, I'd recently found information possibly linking creatine with prostate cancer, but also recommendations not to take creatine within several weeks of having a PSA blood test, since it may artificially raise PSA levels. Is this information correct? And should I not take creatine given my prostate cancer history?
Okay. So this is actually novel to me. I did not know this.
Yeah.
And I'm open to the possibility, but here's where it is. I'm a little skeptical of this because on the one hand, there are test tube studies that show that, creatine is something that energizes cells. And so if you put creatine into a petri dish where you're growing prostate cancer cells in culture, it might actually enhance their growth.
Yeah.
But is that something that happens in the body? This is what's called preclinical versus human trials. On the other hand, there's studies that suggest that creatine actually may enhance the body's anti-tumor immunity, which is the surveillance system against cancer.
Wow.
And also, now they're even doing a clinical trial in men who have prostate cancer with creatine. Why? Because they get something called ADT, androgen deprivation therapy. They basically kill their testosterone, it's a hormone blocker, just like in women, they block their estrogen, with drugs like Femara and, tamoxifen.
Yeah.
But to starve the tumor of hormone stimulation. Okay.
Yes.
And so, but as a result, the men go through instantaneous andropause. They feel weak and tired, and they get sarcopenia. And so they give these men in these clinical trials creatine. They have prostate cancer. So, I mean, I presume that this has to pass some sort of safety,
you would think
screening process before they administer creatine to men who have active prostate cancer. So they say that to determine if creatine when combined with resistance exercise can help preserve muscle mass, reduce fatigue, and improve quality of life for men who are taking testosterone blockers. And they also have found, they did a safety trial. Early results from a 12-week trial indicate that creatine supplementation is safe for prostate cancer patients on androgen deprivation therapy. So they would stop the study if they found like, oh, wait a minute, these men who are taking the creatine, they're getting, better energy, but their prostate cancer, we're seeing their PSA go up on the creatine. That's not good. So, So the answer is that the information is conflicting. And when information is conflicting, we can't act on it. You got to give equal time to the plus side that you give to the minus side. You can say, well, in a abundance of caution, well, we don't take creatine, but everything in life is a risk benefit equation. It's like, I go out the door, to go to the market here in New York because I want to get some healthy food, but I could slip on the ice because it's, it just, to clear the sidewalks, but it, it's more important to get some fresh air and to get the healthy food, so.
Absolutely. I was talking to a private client this morning who said that taking creatine was a game changer for him.
Oh, yeah, really? Tell me.
With regard to his workouts and everything.
Oh, great.
He's 63 years old. It's made quite a difference in his energy levels and everything. And he swears by it. Absolutely.
I take it.
Yeah. Well,
I think I'm learning German faster too,
there you go.
Because it's brain benefits.
Good brain benefits. Oh my God. Bob, there you go. All right. Thank you for your very thoughtful question. We love hearing from you. Let's see here. Dave writes, I have a family history of heart disease, but other than moderate hypertension, I've never had any heart issues or obvious ones. I know in the past you discussed various non-invasive heart tests. What are your thoughts on the multidetector CT scan? Are there limitations? Is it risky? Does it have side effects?
Okay, so I think what he's referring to is what's sometimes also referred to as a CT angiogram. Multi-detector means it's picking up more things. And the way a CT angiogram works, you get some contrast injected into you, and it flows through your blood vessels, and it throws through presumably your heart blood vessels, your coronary arteries, and it can show not just the presence of calcium, but also the presence of what's called soft plaque, which is invisible usually on ordinary CT scans that are not multi-detector. In fact, one of the advantages of what's called an EBT heart scan, which is a CT scan without contrast, is that it's low radiation. It's relatively, X-rays are the lowest radiation. CT scans are multiple X-rays summated. And
more radiation.
There's more radiation, the more multi-detection you have, because you have more slices and more pictures taken. So the biggest downside, I think, is radiation exposure. But if you want to get some delineation on whether you have cardiovascular risk, the best test probably is a CT angiogram. And we talked about it here on this program. We talked to experts on this subject. We've done some podcasts. And so one of the arguments about getting a regular CT is you might have a 0 score. And I had a 0 score, and hooray, I have a 0 score. But then people will argue, but you might have some soft plaque.
Yes.
And
Yeah.
soft plaque, in the absence of any calcific plaque that shows up, he is probably not going to give you a heart attack or stroke,
Okay.
but one of the things that you can determine with a person who has maybe an intermediate score is how high is their risk, because they might have a little bit of calcium and they might have a lot of soft plaque, more dangerous type of plaque. And so it's quantity versus quality. You also want to look at the quality of the plaque, not just merely the quantity of the plaque.
Right.
What also can happen, it's kind of interesting, is you can do sequential CT angiograms and you can see improvement. Generally, you don't see improvement with the regular EBT heart scan or the fast CT that's done coronary artery calcification, the CAC test. Because what's going to happen is you might get more plaque, but it might be good. The hard plaque is more stable. So actually statins show some, not regression of plaque, but generally increases in plaque, but that may be because they're converting the sticky, soft, more dangerous
plaque
into
a calcified.
Yeah. And you like to use the analogy of spackle, right?
Yes. Yeah, it's a repair product. Cholesterol is there to repair. The question to ask is what's causing the damage?
Well, the calcification is the repair. It's to wall off the potentially foam cells and the the whatever endothelial damaged cells. They're walled off, and when they're walled off, it's better because they don't attract blood clots. However, when the calcium builds, it narrows the arteries.
It may cause an obstruction. Yes.
Yeah, exactly.
Yes.
Okay. So,
and that might be something. So, all right. Dave, thank you for that question. Dr. Hoffman, before we go on to more questions, should we hear from one of our sponsors?
Yes, that'd be great. Let's allow one of our sponsors an opportunity to strut their stuff. So here goes. Listen up.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening. Thanks for supporting our sponsors. They, of course, are what make intelligent medicine a free resource to you through their underwriting. And now back to our questions. What's next, Leyla?
This comes from Tina. Good evening, Dr. Hoffman. Last week I started with 1 dose of Calocurb and was excited for the results. Let's explain what Calocurb is. It's made of hops. It's made to act like a GLP-1, like a semaglutide drug, by turning on the so-called bitter taste buds in our small intestine and all of that. And Calocurb has been found to do a pretty good job. So Tina started taking it. She started with 1 dose of Calocurb, was excited for the results. I took 1 pill in the morning and experienced some mild loose stools. That's listed as a side effect at the Calocurb website. You can get some loose stool. That should kind of clear up maybe after a week or two. Tina says, however, the next day I had terrible stomach pain in the upper right side of my stomach and I felt bloated. And I just wanted to ask, could this be a side effect or is this just a coincidence?
Does she have gallstones or anything like that?
Yeah, Tina, that would be our question. Do you have gallbladder trouble or gallstones or anything like that.
Because that's the region of the liver gallbladder.
Yeah.
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 Okay. So, and actually, so this is interesting because this purports to be a natural GLP-1, and that's sort of like a big fad in the natural products industry because there are people who are reluctant to take drugs. They want to lose weight. We've demonstrated how efficacious these drugs are. So people say, well, I want to take something natural. Is there a natural equivalent? So there are a lot of things that purport to be GLP-1 agonists in the natural product realm. But I think Calocurb really is one of the ones that more scientifically vetted and actually has some of those properties. It's not like taking, max dose injections of Bunjaro or Ozempic. It's not the same. It's more subtle. But precisely the side effects of GLP-1s are what she's experiencing. You get a lot of people can't take these medications or they have to reduce their dose because they get loose bowel movements. Alternatively, they get constipation. There's sometimes stomach pain. There's cramps. There's also the risk of gallstones when you take that, but not usually instantaneously because gallstones are the result of rapid weight loss in a short period of time. So, in effect, I mean, it's kind of like reassuring that she's having semaglutide-like side effects with this natural product. But as we know, the most innocuous thing can cause a problem for a minority of patients. So there are patients who can't take a multidetector, patients who can't take vitamin C. There's they can't tolerate it. It's like it bothers them because it is a physical thing that you swallow and goes into your gastrointestinal tract and could irritate your intestine or it could cause, loose bowels, any number, it's possible.
And it's also best to start Calocurb slowly. Start with one dose. One day you want to take it an hour before a meal. Do that again for a few days and then increase it to 2 a day, 1 hour before each meal. Then you can increase as tolerated as you're going because you will find that it works quite well. I've heard some good anecdotal results from clients with
They were a
Calocurb.
former sponsor. They're no longer with us. I mean, they might come back at some point, but they did a trial getting the word out with us. And I accepted it. I said, frankly, I got to tell you, I'm very wary of quote natural weight loss products. I'm very wary because, I think a lot of them just bloat people, like high fiber things. They just bloat you out, and it's like they form like this ball of gel in your intestines.
Eat rope and yank it through.
But, or speedy things, and there've been like speedy things, but they feel like, it's setting your teeth on edge. Like, you've had, double, espresso at Starbucks, so I've avoided, those, but Calocurb, I said, I liked their science. I thought that they had a legitimate claim to be a natural GLP-1 product.
Made of hops.
Yeah, and based on the notion that there are bitter receptors in the intestine and that by stimulating these bitter receptors, we release GLP-1 and produce satiety.
From the appetite. Yes. That is its trick and its gifts. Tina, see if you don't have, a gallbladder condition or something like that, if it continues, certainly. So, all right. Let's see here for our final question. This actually comes from Louise. Dr. Hoffman, I watched a video. It was a short video. It was from Zithya Genesis Medicine. And this is something that's not yet FDA approved. They say that they can inject into the heart a drug, FGF-1, to grow
It doesn't even have a name.
Vessels.
It just got kind of like a code name.
Right. FGF-1 to grow new blood vessels so that if they're damaged or clogged blood vessels, they can be bypassed. And new blood vessels will, of course, bring blood to the heart. Do you have any comments on this?
Well, it's interesting because angiogenesis is a target for medical development. And there So what it is it's angio means blood vessel, and genesis means like the first book in the Bible. It's like the beginning or the creation. Mm-hmm. So there's the creation of blood vessels. And when angiogenesis is happening everywhere in our body as we regenerate blood vessels, and exercise will enhance angiogenesis because there's more oxygen demand by the muscles and you'll get angiogenesis. And there can be some, even after a heart attack, there can be angiogenesis and repair because there may be some blocked arteries, and then there's angiogenesis to kind of like create a detour around the blocked arteries, just like after a traffic jam there, you get off the main road and you go on the service road to get around the traffic jam. So
and
angiogenesis.
FGF is actually fibroblast growth factor 1.
Okay. So here's the issue. In the eye, when you have diabetes, you get angiogenesis, and it actually causes blindness. And so and in macular degeneration also, especially wet macular degeneration. So they actually inject angiogenesis inhibitors because they want to prevent the proliferation of blood vessels, which make you go blind. So they actually have drugs which are angiogenesis inhibitors. Now, for a while, and there's a guy who was a real promoter of this, his name is Dr. Judah Volkman. He suggested that we could cure cancer with angiogenesis inhibitors. And in fact, there was this was exploited in the natural products industry, and they came up with the book, If Sharks Don't Get Cancer. And they were these natural substances, supplements made from shark cartilage, which were said to be angiogenesis inhibitors. Why? Because cartilage doesn't have blood vessels. So they figure if you take shark cartilage, you're going to inhibit angiogenesis and it'd be good for cancer prevention or treatment. Well, it turns out, no, shark cartilage doesn't do anything for cancer. And it turns out also that this line of research about curing cancer with angiogenesis inhibition, because by the way, cancer sends out blood vessel tendrils to fuel itself. Cancers promote angiogenesis. So it was logical to say, block it and you'll starve the cancer will shrink and go away. No, not so easy. All right. Conversely, we want to enhance circulation sometimes in the heart,
we do.
If there's, so this is something which is you
want angiogenesis there when it's necessary.
The problem is you got to prevent runaway angiogenesis, because if it's bad for the eyes and it's bad for cancer, do you want to inject yourself with something that promotes angiogenesis? Might be good for your heart, bad for others. So I think it's interesting. Will we be able to regrow? I mean, they're actually looking at things that can regrow cartilage. That are
good stuff.
So maybe that will be the future. Instead of joint replacement, we'll just inject things into people that will regrow their cartilage.
That would be amazing.
Yeah.
When you think of all the pain, the time you have to spend, the rehab, the PT, all of that kind of thing. Absolutely. That would really be something. Looking forward.
So anyway, so I think that exhausts our questions today. And I thought it was interesting. So check out all the resources that you can find at drhoffman.com. Check out, if you haven't already, our newsletter, which you could subscribe to.
Yes.
And you do the honors on our announcement about FullScript.
Right. Don't forget that you could shop hundreds of curated vetted supplements in Dr. Hoffman's FullScript dispensary. Go to drhoffmanstore.com, where we stock only the highest quality supplements, some of which are very hard to find elsewhere. Very same supplements Dr. Hoffman recommends and takes himself, as do I. Through FullScript, you can access custom protocols that combine the products he recommends to help you achieve your specific health goals. You can begin with a starter kit, then expand with additional protocols tailored to your particular health
Just
concerns.
like the allergy protocol that we had a question about. Yeah.
Yes, exactly. There's bone, there's brain health, there's detox, heart, immune, sleep, and stress support. And buying through FullScript offers fast free shipping and optional refill reminders via text or email, and multiple payment options like Apple and Google Pay. It's safe, it's secure, and it includes world-class service. So go to drhoffmanstore.com.
Thank you, Leyla. So until next week, stay warm and
Yes, everyone.
And we'll stay busy with our other podcasts. Please listen to them. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muden, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.